Welcome everyone. Welcome to Fave YouTube, where we simplify complex pro-metabolic topics into short, easy to understand videos so you don't need a PhD to improve your health. In today's video, we're going to talk about stress hormones, specifically the catecholamines. That's adrenaline and that's noradrenaline. Now these are the hormones that cause the fight or flight response. That's the response when you are threatened by something and you get the anxiety and you have either the motivation or the inclination towards run or to fight. And essentially it creates a very strong stress response. Now, these hormones are upregulated in other circumstances outside of just like a general fight or flight response, emergency response. These hormones can be upregulated under normal circumstance and caused by many different components inside your lifestyle. And we're going to talk about those in today's video. But the symptoms that many people experience from these specific hormones can include cold hands and cold feet. So if you're wondering why you have freezing cold hands and freezing cold feet at certain times of the day or in general, that could be upregulated catecholamines, which go hand in hand with low thyroid function, which we'll talk about. These hormones can cause anxiety, agitation, and low mood. So if you waited too long for your next meal and you get hangry, or you're having high levels of anxiety throughout the day, or you're getting agitated or snippy with friends or family or your partner or something like this, it may not necessarily be because of something they did. It could be because you have a higher resting tone of these hormones. And in my experience working with clients, what I've seen is people who run low carbohydrate diets or do tons of fasting or excessive amounts of exercise can actually experience these rapid mood shifts and changes to their personality over the long term from upregulating these stress hormones and then creating these negative mood responses. Now, the next one is a racing heart. If you find that sometimes you get palpitations, you get a racing heart, you get symptoms of tachycardia, that could be related to an increased sympathetic activation on your heart. So an increased production of these hormones, norepinephrine, epinephrine, or other names are adrenaline and noradrenaline, impacting the heart and increasing the heart's contractility and the heart's rate. Now, a lot of times it's extremely uncomfortable for people, and it actually isn't normal to have this happen on a consistent basis. This would indicate, at least to me, and something that I think about when I'm working with my clients, is under normal circumstances, if this is happening, this is indicative of a stress state. This could be a symptom for an individual. The next one is sweating. If you find that you sweat excessively, and this is sweating from the palms of your hands, from your head, from underneath your arms, from your groin, these are major areas where people tend to sweat, especially under stress circumstances. This is under the action of these hormones. Another one is poor sleep. If your sleep is pretty poor, you're waking up all throughout the night, every hour, hour and a half, you have a hard time falling asleep, you're waking up sweating, you're waking up with a fast heart rate, you're waking up with nightmares and racing thoughts, this can be a function of a higher sympathetic tone or a higher general stress that could be triggered by low blood sugar throughout the night. And I tend to see this get worse in people who are coming from low carb diets or intermittent fasting or carnivore over time. Initially, they seem to get better when they first go on these diets, coming from a standard American diet, because there's no problematic fibers and irritating components going to the digestive tract. And there's an increase in fat, good fat sources, and also good protein sources inside the diet when switching to those diets. But over time, because there is no carbohydrate intake and then food, the spacing of food throughout the day starts to become sparse and people start to engage in fasting, these stress hormones ramp up because we don't have enough carbohydrates and energy on board on these diets. Another one is bad digestion. So if you're finding that you're getting constipation or you're getting just the runs, this could be a function of adrenaline and noradrenaline. Now, why does this happen? Because noradrenaline and adrenaline will decrease the blood flow to the gut under stressful circumstances and reroute it towards the brain, the large musculature, and the heart so that you are able to handle whatever the stressful situation is and not prioritize digestion because it's not as important in that point in time. Now, the last one is actually a sneaky one and kind of something that I see with quite a few people is excessive and frequent urination. And this is due to the impact of these hormones on the tension or tone of the bladder and then also the outflow of, and the sphincter muscle control on the bladder. So you can start to get frequent urination when under stress. Now, most people don't actually develop all of these symptoms from these hormones. In my experience and my personal theory around this is that different people respond differently to these hormones based on their inborn inclinations. Perhaps there's a receptor change in certain receptors for these hormones, or maybe there's their hormonal profile is a little bit different. So somebody may get palpitations, whereas another person may get sweaty, whereas another person may have frequent urination, whereas another person may have problems with their sleep. For me, it's sweating. If I have an excessive amount of coffee, if I'm working out, if I have a stressful circumstance, I don't get palpitations. I don't really get a terrible mood or anything like this, but I can start to sweat pretty profusely, particularly from under my arms, whereas I had other people where they'll just get really frequent urination. For me, I will get that, but not in really a severe circumstance like I've seen with some of my other clients. Now, why are these stress hormones causing these symptoms? When you're under stress, adrenaline and noradrenaline's function is to provide substrate or fuel sources in the form of fat and carbohydrate to the tissues that need it to deal with this stressor. Their job is also to reroute blood supply to the tissues that need it to deal with the stressors as well. And so they have a variety of different effects that they are creating to optimize this response across multiple bodily systems. So at the fat tissue, adrenaline and noradrenaline are releasing fatty acids into the bloodstream. So they're increasing the amount of fats floating around in the bloodstream so that these tissues can uptake those fats. They also are pushing fat burning inside the mitochondria. Both these things are problematic. Why? Well, one of them is via the Randall effect, which you can check out on my Mike Fave Science YouTube channel, where I discuss what the exact Randall effect is, what are all the mechanisms. If you're really into the research, I go in extreme depth there. But essentially, when you are burning fats and you have a lot of fats floating around in the bloodstream, you're not going to be so good at burning carbohydrate. So adrenaline can actually induce an insulin resistance or impair carbohydrate oxidation by forcing fat oxidation and increasing the amount of fats floating around. Plus, inside the mitochondria, when you start to burn a high amount of fats, you can start to increase the amount of reactive oxygen species, which is essentially smoke in the mitochondria that can actually damage its structure. And just as a reminder, the mitochondria is the powerhouse of the cells. The next thing is the adrenaline and noradrenaline's effect on the cardiovascular system. So from the heart, adrenaline and noradrenaline can actually increase the contraction rate and strength of the heart. So these hormones will make the heart beat faster and make the heart beat stronger. Under normal circumstance, you're going to do some exercise, something like that, that's fine. But when you chronically upregulate this process in conjunction with forcing the fat burning, you can actually damage the heart. And so people who have heart attacks actually tend to have much higher levels of adrenaline and noradrenaline, and it's thought that these hormones are contributing to this effect. And also, in people who are dealing with arrhythmias, adrenaline and noradrenaline and the sympathetic activation of the heart can actually predispose towards that arrhythmia by putting pressure on the heart, the metabolic pressure, increasing demand on the heart, and then you're also increasing the rate at which the heart has to contract and changing the metabolism. So all these things can put pressure on the heart, not to mention that adrenaline and noradrenaline can cause constriction of the blood vessels. So for your peripheral blood vessels, it can cause them to constrict, and then the blood supply to the gut, they can cause to constrict. Now, this is problematic. This is what causes that cold hands and that cold feet, but this is problematic because now you have a higher vascular resistance for the heart to pump against, and this is also to allow, there's other areas that will dilate, like the blood supply to large muscles, the lungs, the heart, and also the brain to provide supply to them. But then you start to get issues with the digestive tract where it actually diverts blood flow away from the digestive tract. And this is problematic because you can essentially, in extreme states, get ischemia or a significant lack of blood supply to the digestive tract. And in really stressful states, this can actually cause stress ulcers. So the intestinal lining starts to die because it doesn't have enough blood flow. So we don't want to drastically upregulate these stress hormones because now we're creating like the extreme form of a leaky gut. And then we also have the food that's sitting there won't get digested that can go into the microbiome depending on what you eat. And then that can create endotoxemia, serotonin release, and all this type of stuff, which is what people tend to see when they get diarrhea, when they have anxiety or extreme stressful states. That's adrenaline, noradrenaline, and then a serotonergic response to the lack of blood flow to the gut and the fermentation of food in the intestine. Adrenaline and noradrenaline, the catecholamines, can increase glucagon secretion. Now, glucagon is the hormone that increases the production of glucose by the liver from amino acids, fatty acids, Those are the main sources. And also the breakdown of glycogen, the storage of carbs in the liver. This can directly increase your blood glucose, but this is also happening while you've increased fatty acids in the bloodstream. And this is problematic because, again, you're not going to burn both fats and glucose at the same time. So you're creating a state where you have insulin resistance at the cell, and then you have a lot of blood glucose floating around from the production via glucagon, and this is part of the states that drive the insulin resistance, metabolic syndrome, diabetes, etc. So we don't want to drastically increase glucagon secretion, and I've talked about this in other podcasts that Jay and I have done together, where in obese individuals who aren't diabetic and then diabetics, glucagon secretion is highest in the diabetics, then it's the obese individuals who aren't diabetic yet, but they have impaired glucose tolerance, and then lean individuals actually have lower amounts of the glucagon secretion because glucagon is involved in that metabolic dysfunction. Now, the next piece is the catecholamines can induce the release of something called ACTH, which is the hormone produced in the hypothalamus that acts on the adrenal gland to induce cortisol secretion and also aldosterone secretion. And in my previous video where I talked about aldosterone, what we can see is that aldosterone has problematic effects on the blood pressure and the vasculature as well. So the catecholamines can also increase that RAS system. And then we're also increasing cortisol simultaneously. So we really don't want to drive the catecholamines excessively, and then because it'll subsequently upregulate these other stress systems that are highly problematic. This is actually relatively unknown, but the catecholamines can cause immune dysregulation. So they can also have an immunosuppressive effect and worsen infection in extreme states like in sepsis. Using catecholamines to help maintain blood pressure can actually worsen infections because of their effects on the immune system. So people tend to think that just cortisol is immunosuppressive, but the catecholamines can also have immunosuppressive or immune modulatory effects that are not favorable in the long run. So why do we even have hormones like the catecholamines if they do all of these damaging things? Well, in the short term, these hormones are life-saving. You absolutely need them. If you have to run away from a tiger, if you're in a fight, if you don't have enough food on board, then you're going to want to have these hormones available so that you can prioritize nutrient and blood flow to the really important areas to deal with the circumstances while deprioritizing other areas in the short run because they're not that important in that point in time. It's not important that you digest your food if you're being chased by a lion or you're about to be in a fight. It's also not important to have optimal immune function in a fight, nor to have optimal gonadal function or something like this when you are, you're starving. So you want to lower those functions in these states, but to run this long term has pretty significant and severe consequences. So we don't want to prioritize running high levels of catecholamines, which is something that's actually talked about as a benefit in the intermittent fasting crowds and the low carb crowds and the keto crowds and carnivores. Like, oh, you get X number % of increase of adrenaline, noradrenaline, and growth hormone when you're fasting. It's like, that's problematic. We don't want to have these massive increases in these hormones because they are actually stress hormones. If you're going to be in a workout, you're going to see a bump, sure, but then you want them to come back down after that bump is to deal with the workout, and then you want to recover from that. We don't want to just keep them high all the time. So with that, the solution here, the primary, number one, most important solution is to lower baseline sympathetic tone. We want to keep the catecholamines lower in general. And the way to do this is actually relatively simple, and it's largely around lifestyle components. So the first one we want to do here is we want adequate calories. The next one is we want adequate carbs. We don't want to be low carb. It's going to drive fat burning, which is going to raise these hormones. And then the fat burning, as I mentioned, is quite problematic in the mitochondria. And I described exactly why on my Mike Fave Science YouTube channel talking about reverse electron transport. Now, the next thing is we want to avoid fasting. We don't want to have really long periods of time where we're not eating. If you fast 12 hours overnight because your last meal ended at 8 o'clock and your next meal is going to be 8 a.m., whatever. But we don't want to be doing these 20, 30, 40, 50, 60-hour fasts or more because that's quite problematic for the body overall because you're relying on these stress hormones. And that's why you see people like Dave Asprey actually reversing partly his stance on fasting. And you see people like Peter Attia saying, oh, I lost lean mass after 10 years of this intermittent fasting stuff. And it's like, yes, because you are upregulating these stress hormones, which includes the catecholamines, but as well as cortisol and glucagon. So we don't want to push these things. The next thing is we want to make sure that our exercise intensity and volume is dialed in appropriately. We don't need to stop exercising, but we need to make sure that our body can recover and handle that exercise and that we're feeding and supplying this exercise. So if you're a normal person who's just trying to lift in general, you want to look at how many sets per week of exercise you're doing and then understand, like, how are you recovering? What's going on with your recovery? How is your sleep? How is your libido? How is your energy? How are you feeling after your workouts? So you want to make sure these things are dialed in effectively, and you also don't want to be exercising and then not eating enough. That's highly problematic because, again, you're shorting your recovery. The goal of exercise is to provide a stimulus so that you can induce an adaptation to this specific stimulus. For example, with lifting weights, you want to provide mechanical tension to the muscle to stimulate specific mechanisms for growth. But we're not trying to just stress the crap out of the muscle and then break it down and not supply it. That's antithetical to the overarching goal. So we want to make sure that that is dialed in effectively. The next thing is we want to balance our meals across the day so we're also not having blood sugar drops, which can raise these hormones adaptively, because hypoglycemia is a major trigger for increases in glucagon and increases in adrenaline. So to keep baseline level low, we want to have consistent meals across the day where our macronutrients are balanced effectively. The next piece is a really big one, and that's making sure that your thyroid function is absolutely dialed in. Now, why is this so important? Well, thyroid controls the sensitivity of the cells to the sympathetic nervous system and the sympathomimetics, the catecholamines, adrenaline and noradrenaline. When you are hypothyroid, your sympathetic nervous system activity, that adrenaline and noradrenaline levels actually increase because your cells are not very sensitive to those hormones anymore. So paradoxically, usually people think, oh, adrenaline, I have all this energy. The hypothyroid person who has low energy is actually high adrenaline. And that's, again, because their cells are not responding to the adrenaline, so you need more adrenaline to get the response. Now, this also explains why people have problems when they first start to introduce thyroid, or if they're trying to introduce thyroid, coming from low carb, keto, intermittent fasting, carnivore, is if they have a high sympathetic tone and then they take thyroid hormone so that they're now sensitive to these sympathetic hormones like adrenaline, noradrenaline. Now they're going to be really sensitive to all of this activity they have going on. And that's why it's important to actually dial in the foundation first before just slamming T3 or something like that. I'm not recommending that people do that. Some of that gets promoted in the repeat sphere, and then people start to have problems and think, oh, I won't ever tolerate thyroid. And it's like, you're just not in the right state to necessarily tolerate it yet, or you have to use it in an appropriate manner. Now, the next piece is mineral balance. I talked about how the RAS system is directly involved in increasing the sympathetic nervous system, and the sympathetic nervous system also increases the RAS system. So we don't want to drive problems with the RAS system, the renin-angiotensin-aldosterone system. I covered this in my previous video talking about aldosterone. So we want to make sure our sodium-potassium balance is dialed in. We don't want to just have low sodium. We want to have adequate sodium and adequate potassium. We also want to make sure we have adequate calcium, magnesium. The magnesium itself has a relaxing property and helps to lower those catecholaminergic levels and the responses. It helps to have a blunting response. And then calcium helps to lower the parathyroid hormone, which is involved with RAS system activity and also the sympathetic nervous system activity. So we want to keep all of those things dialed in effectively so we're not relying on these stress hormones. Another thing we want to do, adequate vitamin intake is absolutely important. There's many vitamins that are involved with the metabolism of catecholamines, the breaking down of them, the production of them, the conversion of them, etc. So we want to make sure that all of that is optimized so things move appropriately, can be metabolized appropriately, etc. So that's things like your B vitamins, your vitamin C, your fat-soluble vitamins, etc. Now, after all of this, if this is all dialed in, I bet a vast majority of people, 80-90% of people, will feel significantly better. But there's also things that you can use as needed to help lower a stressful, sympathetic, nervous system-driven, catecholaminergic, adrenaline, noradrenaline response. And there's very basic supplements that are available over the counter. The first one is a group of amino acids. You have L-theanine, you have taurine, you have glycine, and you have GABA. These 4 amino acids have a calming effect on the nervous system, and they can overall bring down sympathetic tone, at least for a period of time. So you can rely on these. These are over the counter. They're relatively safe. There's not really much problem with them. You can find them in most dietary supplements already. So there's a benefit to those. And then for something like glycine and taurine, there's actually other health benefits outside of them, outside of just lowering the catecholamines that they can be useful for. And I'll talk about those in future videos. Other components are adaptogens. So 2 calming adaptogens that can be used to help lower sympathetic tone and stress in general would be ashwagandha and schisandra. These have been tested and actually been shown to lower the glucocorticoids. There's some specific effects on catecholamines, and it's through affecting what's going on with adrenal function. So these can be useful. Again, I wouldn't abuse these. I would get the foundation right first and then kind of use these as needed. For example, when I was working in the ICU, and I was doing 4 shifts a week, so it's 48 hours a week during COVID, and I was working with my clients on the side, I was using ashwagandha on the day that I worked in the hospital because the stress level was just so high with what was going on with all the people who were quite sick and people who were coding and all this type of stuff. So that actually helped to blunt the stress response for me. The last 2 are neurosteroids. And the 2 neurosteroids that can be quite helpful here are pregnenolone and progesterone. Now, pregnenolone can be used for men and women. Progesterone, I personally discuss with women in general or provide education to women in general on progesterone. DHEA is another one, but this can actually increase some anxiety for people because it has a little bit of a different effect on the catecholamines. But the 2 calming ones would be pregnenolone and progesterone, and those can be used. They basically lower the stress systems inside the brain by modulating GABA activity, and that can help to lower the whole stress system throughout the body. So these are some simple options that you can use as needed once your foundation is built out to lower and manage the catecholamines, adrenaline, and noradrenaline. And if you want to understand how to dial in your foundation a little bit better or a little bit more in depth, then you can check out the Nutrition Blueprint, which is free on my website, mikefave.com, which goes into how to set up your diet appropriately, manage your macros, and this will effectively help you to keep that stress and those catecholamines down.